Are you dreaming of having a baby that is already shredded as soon as they come flying out of the womb? Well, let me tell you about Ozempic Babies. Kidding. Kind of. No, definitely kidding. Yeah, definitely kidding. Today, I'm going to be diving into the wild and surprising world of the women that are having unplanned pregnancies while taking anti-obesity medications. And social media, being its usual over-the-top self, has dubbed these wonderful bundles of joy the Ozempic Babies. Now, there's definitely a couple of things going on here. First and foremost, some women that are struggling with obesity may also be struggling to conceive. And the reasons for this can be about as varied as the cravings that may arise during pregnancy. One of the major players, though, is polycystic ovarian syndrome, or PCOS. Now, PCOS doesn't discriminate in terms of body size, but for women that have PCOS, it can be problematic because gaining weight can make the PCOS symptoms even worse. As well, we are finding that some women may be experiencing a new condition called obesity-related hypogonadism. Now, this is something that we have primarily seen in the male counterpart, but it is becoming more apparent in females as something that may be going on and limiting or making it more challenging for women to conceive. The other factor that we need to take into account here is that medications such as tirzepatide or Zepbound actually can slow down gastric emptying, which may have an effect on birth control pills, in that we don't get as much absorption and therefore the birth control pill could become ineffective. So if you're currently taking Zepbound, Wegovy, and what have you, and you're currently on a birth control, oral birth control pill, it may be time to consider a different form if you want to avoid pregnancy. In terms of PCOS and the obesity-related hypogonadism, though, it seems that losing weight can actually improve fertility. In PCOS, losing a few pounds can actually help to regulate menstrual activity, it'll help with insulin resistance, and help to bring some of the hormonal aspects into balance and ultimately allow you to conceive. Similarly, that seems to be the case when it comes to the obesity-related hypogonadism. And now for another depressing statistic for you, only 20% of you that are currently watching this video are subscribed to my channel. So, if you're watching, and of course you are enjoying this content, you should definitely hit that subscribe button down below and turn on your notifications so you don't miss out when I put out another video. Not only do you get to keep enjoying some awesome content, but you make me feel pretty darn good about myself. So thank you for the ongoing support. Now, if it isn't already clear, the GLP-1 medications such as Wegovy and Zepbound can help promote weight loss. And if we're struggling with conditions that affect fertility, and if we suddenly lose some weight and fertility improves, well, we get the Ozempic Baby. But do we have anything that we need to be worried about? Well, first and foremost, Ozempic, Wegovy, Zepbound, all of the GLP-1 based medications are contraindicated or a big no-no in pregnancy. First off, we haven't actually studied these medications in women that are currently pregnant. As well, it's definitely not recommended women who are pregnant to be on these medications because, well, we don't want them losing weight. Further, when we look at the animal studies, what we have seen is some not so cute outcomes. There have been things like birth defects, early pregnancy loss, and low fetal birth weight. Now, a small caveat here is that in the animal studies, they were using super high doses of the GLP-1 based medications. So it's a matter of, was it the medication that led to this, or was it the extreme amount of weight loss, not consuming enough nutrients, and so on, that caused the effects that we saw within the animal studies? The jury is still out on that one, but regardless, we do not want to be using these medications in pregnant women. Now, what if you're currently taking one of these medications and suddenly you're staring at a positive pregnancy test? What do you do? First and foremost, you need to stop the drug immediately. You then need to follow up with your care team and make sure that you're being properly monitored, assessed, and all sorts of things like that. Unfortunately, with the longer acting guys like Ozempic, Wegovy, and Zepbound, they can remain in the system for up to a period of about 5 weeks or more in some cases. And therefore, there can definitely be some exposure of the fetus to the GLP-1 based molecule. Whereas the short-acting GLP-1s such as Saxenda that are given on a once daily basis will clear the system much more quickly, usually within a week or two. Now, fortunately, based on case control studies where women have been accidentally exposed to these medications during the first trimester of pregnancy, we haven't seen any negative outcomes, at least at this point in time. And hey, if you're looking for some more information on the GLP-1 based medications, maybe it's something that you want to take to a party and show to your friends, or maybe it's something you want to use when you go to talk to your healthcare provider about starting one of these medications, you can go down below, click on the links, and you can get my GLP-1 medication info sheet emailed directly to your inbox. Again, head down below in the description, click on it, and you will enter your information and you will get my nice, lovely info sheet. Now, for the women that are currently on one of the GLP-1 medications, and perhaps you have chosen that you and your partner would like to try and conceive, what are the things that you need to be thinking about in order to go about that as safely as possible? Again, you want to huddle together with your good old healthcare team and providers to come up with a really solid game plan. And then we want to look at coming off the medication safely, allowing the medication to clear your body entirely, and then you can go and try and conceive. Again, with the longer-acting medications such as Wegovy and Zepbound, we want at least an 8-week period that gives us enough time to fully clear the drug out of the body and ensure that there is none that is going to be remaining and potentially exposing the fetus. The shorter-acting agents such as Saxenda, we want to give you that 2-week period to ensure everything is cleared out. And while the drug is continuing to clear out of the system, making sure that you're staying on whatever birth control or anti-conceiving methods you have available, and ensuring that you're not going to be exposing a potential fetus to the drug in that period of time. Now, I know some people will be worrying about regaining weight during the period that they come off the medication prior to trying to conceive and such, and may that potentially affect their ability to then conceive. These are very, very valid concerns, and ultimately we still need to have these safety periods in between to ensure the safety of the fetus. But this is why talking with your healthcare team, coming up with a game plan, and finding a way to slowly transition you off in order to prevent any severe or significant weight regain, and ultimately allowing you to become pregnant. So that's going to be looking at your lifestyle changes, making sure you're getting plenty of protein, making sure your activity is good and high, and maybe even starting a medication like metformin, which is safe in pregnancy. Again, these are all things that you need to chat with your care team, but those are kind of some of the example things that we may look at. The final tip that I sometimes have for people is that if you're currently on a long-acting agent such as Ozempic Wegovy, what I might do is switch you to Saxenda, which has a quicker clearance time, switch you to the Saxenda, and then have you come off of that, and you only got to wait for that 2-week window before you can try and conceive. Much less risk of trying to deal with that weight regain and such like that, and ultimately, hopefully not negatively affecting the pregnancy experience. So that is it, and that is all, you beautiful people. Are the Ozempic babies a thing? Yes, they technically are, but they're not the shredded Ozempic babies that I was describing at the start. It does seem that the GLP-1 medications are providing a fertility boost via weight loss, but we need to keep in mind that these medications are currently contraindicated in pregnancy, and so we need to be mindful of that. And if we're using oral birth control or, kind of not taking that into account, we need to be careful if pregnancy is not something we're striving for at this given time. We simply don't have enough data. There might be some potential harms, and again, weight loss is not recommended during pregnancy. The bottom line, which I will continue to hammer away, is that you need to work with your healthcare team to ensure that you are utilizing this medication in the safest and best way possible so that you have the ultimate outcomes for not only you, but also for that little bundle of joy. Sweet. I hope you enjoyed the video. Of course, if you did, don't forget to share it with all of your friends, family, and anybody you think might get some value out of it. And of course, if you haven't subscribed to my channel yet, then you best be hitting that subscribe button down below. You're not only going to make me feel really good about myself, but you're going to get to keep engaging with and enjoying some really wicked content. As well, don't forget to sign up for the OG Members membership side of my YouTube channel. With the OG Members, I do a live at the end of each month. We cover some topics that don't show up in my regular YouTube feed. Plus, you also get to support myself because I do all of this content creation in my free time. So go down below, click the links, and sign up today so that you can get access to that wicked content and support one of your favorite creators. As well, don't forget to check me out on my other channels, and as I always like to sign off, please remember that it's the small tweaks that lead to the massive peaks.